Hello everyone, today I'm gonna tell you about the topic related to how to control release growth factor from hydroxyapatite coating on interface screw applied for cruciate ligament reconstruction surgery. This is my outline. First, when it comes to purpose and ideas, the purpose and ideas of this pattern come from the clinical problem. This is about ACL injury. There are three kinds of injuries. In this case, complete tear cannot heal by itself, so it's required to conduct ACL reconstruction surgery. However, for ACL reconstruction surgery nowadays, it has to face some kind of problems. In this problem, the lack of graft fixation plays an important role for the effect of this surgery. Next, for content about the pattern. This pattern is a bioresorbable screw. It includes three components. The first component is a growth factor biomolecule. The second is a hydroxyapatite coating, and the last one is a polylactide substrate. The first claim, they mention about an implantable scaffold that includes a bioresorbable substrate, and there are two steps to make it. Firstly, surface hydrolyzing the bioresorbable and then incubating it with calcium ion, phosphate ion, and growth factor. During incubation time, hydroxyapatite can grow on the bioresorbable substrate. And the second claim related to an interference screw. The main point of it is the same with claim 1. I mean about its component and how to make it is the same with an implantable scaffold. The next claim is related to an orthopedic implant that's used for controlling the delivery of growth factor. For its structure, it contains two components. The first one is a bioresorbable scaffold, and the second one is a bioactive coating. And how does it work? The answer is the growth factor will be bonded with a calcium and phosphate from a bioactive coating. The fourth claim, it demonstrates about how hydroxyapatite can grow on a bioresorbable substrate. In general, for this method, I mentioned it in the content of claim 1 before. And the last claim also demonstrates about an orthopedic implant. Basically, its structure is the same with claim 3. However, about its component and mechanism for it is different from the claim 3. When it comes to comparison among these claims, you can see the claim 1 has relationship with claim 2, 3, 4, and 5, and claim 3 has relationship with the claim 5. Particularly for claim 2, you can see the difference is about object. However, its component and method is the same with claim 1. Next, for claim 3, the difference between claim 1 and 3 is there are an additional component. This is a bioactive coating. In addition, the difference between the claim 3 and claim 5 is related to mechanism of bonding between factors. Particularly, instead of growth factor will be bonded with a coating, you can see the claim 5, this is B and B2 will be bonded a bioactive coating. About confirm and application. This is a bioscrew. It's used for tendon bone tunnel healing after ACL reconstruction surgery. In addition, to improve the effect of this surgery, this device combines some growth factor like BMB2 with calcium phosphate to enhance healing effectively. Thank you for your attention.